I am Michelle Jacqua. I'm a registered nurse case manager, and I worked in the insurance industry for many years. I don't work in the insurance industry anymore. I learned my lesson. I now help lipedema women navigate them through the medical and the health insurance systems, and a lot of that is with prior authorization, which I'm going to talk about today. I also have lipedema. I was diagnosed in 2021, and I had my own liposurgeries in 2022. And just like everybody else, I had to do my own prior authorization. Okay, this is my financial disclosures. So, as lipedema women, we have to navigate our own prior authorizations, and most of us don't know how to do that. We're not insurance experts. On top of that, prior authorizations, as you can tell from Leah's her presentation, insurance is extremely complex. Prior auths are extremely complex and time-consuming for us, especially our prior auths. Also, insurance is not designed to work with members or patients. They're designed to work with providers. So we're at quite a disadvantage with our prior authorizations. If you're considering lipedema reduction surgery, then this is, and you don't know where to start, this is a presentation that's specifically for you. My goal today is to make this complex process a little easier to understand, and I'm doing that by breaking it down into 6 steps, 6 basic steps, but don't think that it's a basic and an easy process, but I've broken it down to 6 manageable steps, and these are my steps. Step 1 is to obtain and review a medical policy. It says insurance policy, it's medical policy. Again, you can get that through your SPD, or you can, I'll go through that later. Step 2 is to consult with a lipedema surgeon. Step 3, gather your medical documentation that you're going to need for your prior authorization. Step 4, obtain a prior auth form. 5, submit your prior authorization. And 6, last step is to follow up on your submission. Okay, so prior authorizations are guided by your medical policy. The best way to find your medical policy is to call your insurance, contact your insurance, and ask them, and you can use this verbiage, ask them for a medical policy for lipedema surgery. If they don't have that, don't panic. You can still do prior authorizations. You can go through the process of getting your SPD, as Leah had talked about. You can also maybe look for it online. I've Googled and found lots of lipedema reduction surgery medical policies just by Googling it, but the best way is to contact your insurance. Okay, so how do you know you have an actual medical policy in your hands? What does it look like? What I have here is a snapshot of the header of an actual medical policy with an insurance company. And the policies all have a universal look with indicators. So I wanted to give you a visual of what the header of a medical policy looks like so you have an idea of what you're looking at. The indicators are typically in the upper left-hand corner. There is a logo and the name of the insurance company, a lot of times with the type of plan it is also. The title of the policy is in the middle. This one is titled Liposuction for Lipedema. You have it labeled as a medical policy, as you can see in the upper right-hand corner. It says United Healthcare Community Plan Medical Policy. That labels it as a medical policy with a policy number and an effective date. Some medical policies, but not all of them, also have a table of contents and related plan policies. So this is what you're looking for. Every insurance policy is going to look a little bit different, but this is just universally how they look and how you can tell that you have a medical policy. Step 2 is consult with a lipedema surgeon. So the surgeon is going to provide a surgical treatment plan for you, which you will need for your prior authorization. The first step is, again, to contact your insurance and find out if they have an in-network provider that does liposuction surgery for lipedema. Like I said, that was mentioned earlier, insurances drive their members towards in-network providers because they already have contracts in place. Many insurances do not have any kind of contracted providers. But please do your due diligence on that and see if you have an in-network provider through your insurance plan. Otherwise, we all have our own preferences for our lipedema surgeons. On the insurance side, I recommend that you find a doctor who is open to working with your insurance and working with a financial contract with your insurance plan. If they help you submit your prior authorization, that is even better. Okay, step 3, gathering your medical documentation. This is the one that really kind of freaks everybody out. So I want to go and I want to take a little bit of time on this, go through it a little more in depth than I will with the rest of the steps. So with gathering your medical documentation, this is your chance to prove that your surgery is medically necessary. You'll hear that a lot, medically necessary and not cosmetic. So your goal is to show that the procedure, liposuction surgery, will relieve your pain and improve your functional mobility where your conservative care has failed. There are certain things that are universally gathered for medical documentation. I have made a list of this, and it aligns with the typical type of medical criteria that is in medical policies. I'll briefly go through this list, and if you have any questions about this, you can always contact me afterwards. Just reach out to me. But first of all, you have your clinical notes of working with a specialist with lymphatic, like certification in lymphatic drainage. Any kind of treatment receipts, anything you've paid out of pocket for your lipedema treatment. A diagnosis, a documented formal diagnosis, you'll definitely need that. Any kind of documentation of worsening symptoms, regardless of your conservative care. Photos of your body, you can get photos usually through your diagnosing clinician, lymphatic therapist, sometimes the surgeon will do those photos. I've even had women do their own photos. Functional capacity evaluation. This is a separate evaluation that measures your functional mobility and your pain level. Letters of medical necessity, ideally from a diagnosing clinician and your surgeon, and then a surgical treatment plan. Okay, so this is a snapshot from a medical policy, the body of a medical policy that shows the list of criteria you'll need to provide for your prior auth. It is not your medical policy, but it is a medical policy. They typically have very similar criteria that they want to have you meet, and I want to go through that a little bit and see how that aligns with the information or the documentation that I just talked about. So here's bulleted points. The first is significant functional impairment. That would align with your functional capacity evaluation. The individual has not responded to at least 3 consecutive months of medical management, and that would align with working with your lymphatic therapist for 3 months. Typically, that's once a week for 12 weeks. Let's see, post-operative plan, that would be in your surgical treatment plan. Documented diagnosis, of course, and then photos. Every plan is probably going to be a little bit different, So you'll want to look through, review the criteria, and give the information specifically based on that criteria. Okay, so the next 3 steps are going to go pretty quickly because they're very straightforward. Step 4, obtain a prior auth form. Each insurance has their own forms. So again, contact your insurance. Directly ask them for a prior authorization form. A lot of times they have them on their websites, and you can download them. You'll fill out your portion, and then you'll need to collaborate with your surgeon's office because they'll have a portion that they have to fill out also. Step 5 is to submit your prior authorization, finally. So you have your filled out prior auth form. Attach all your gathered documentation. Make a copy of everything that you have. You don't just want to send it off. Then you can ask if your surgeon can submit your prior authorization. A lot of surgeons are doing this now. And like I said earlier, insurance is set up to work with providers over patients or members. So it's ideal that if the surgeon can send in your prior auth. Otherwise, if that isn't the case, then you can check with your insurance plan and find out what their submission process is. The mode of your submission, either fax, online portal, however they want you to send that in. And then step 6, last step, is to follow up on your submission. Your goal is to keep track of your prior authorization so it isn't lost in the system. Typically, when they get a prior authorization, they will put it into their system, and then they will give it either a confirmation number or a reference number. So see if they have that and get that reference number from them. And then follow up regularly with them. Check the status. You can do that daily. I am a proponent of that you cannot call your insurance enough. So if you have any questions, always contact your insurance. I also recommend that when you call your insurance, document every call just for your own organization and to keep your mind of where you're at, the date, the time, who you spoke with, what the conversation was about, and then what the outcome of the call was. Once they make a determination, you will get a letter in the mail, typically. So you'll get a written confirmation of either an approval or a denial. And your surgeon, especially if they sent in the prior authorization, they will also get confirmation. And then you go from there. And those are my 6 steps. Thank you. I don't want to downplay that this, thank you very much. I don't want to downplay that this is a really complex and overwhelming process. These steps are just here to guide you through that process. And know that a lot of us have already done this. A lot of us have gotten coverage for our liposurgeries. So if you're looking at getting liposurgery, reach out to resources, advocates, women who have already done this. We're all out here to help you. Thank you.
We do have some questions for you.
Oh, okay.
Should we send personal impact statements when we submit our pre-auth?
Okay, I have very strong opinions about personal impact statements. First of all, they don't ask for a personal impact statement in the medical policy. If you look at any other medical thing that you need prior auth, you don't need to give a personal impact statement. Say you have a knee surgery, you don't need to talk about your knee journey. Is it helpful? I think it's cathartic to write it out. And I know that this is a trend. I don't know where the trend started. And honestly, it's up to you if you feel like you need to do that. I personally don't think it's necessary. I have seen people get approved without doing a personal impact statement. That's just my personal opinion on that. So,
why are patients submitting prior authorizations for medically necessary procedures when it's customary and expected that the doctor's office will seek prior authorization for the patient?
I believe that that's because our surgeons are considered cosmetic surgeons mostly, and they have not worked with insurance. I think they're also not set up in their office to do that, but I don't really have inside knowledge on that piece. Our prior auths are also very complex. We need to gather a ton of information from all different types of treatment that we've had. We typically get a lot of treatment, and our prior authorizations are a lot of times 70 to 100 plus pages that we have to send in. I'm hoping that in the future that we will be able to work more with the surgeons to do that, but again, it's just a really new process and specifically for our surgeons, and I know that they have really stepped up a lot in the last couple years to help with prior auths and help work through that. So yeah, that's it.
Okay, thank you very much.
Thank you.